Dr. DeCubellis here. I want to take this minute to talk with you because this is something that's really, really important. I don't think a lot of people understand when it comes to accidents, injuries, traumas. So the first thing is that when you have an accident, injury, or trauma, your body is going to heal. Does not mean it's going to heal the right way, but it's going to heal either the right way or the wrong way. Now, how it heals is going to determine what you're going to be feeling in a couple months or a couple years. If it heals the wrong way, that means we're talking about permanent issues, things that are going to pop up as you are going through life, but also other issues in other areas are going to pop up because those parts are compensating for the underlying problem. Now, here's where the big issue comes in. A lot of doctors do not take this into consideration, not only when they do the diagnosis, but when they do the treatment too. So here's what I mean. If you have an injury, and let's say you injure your low back, go to your primary care doctor who is not an expert in these areas. His expert is treating illness and disease, not injuries of the musculoskeletal system. So that's totally okay, but he sends you to physical therapy with an issue of saying low back pain. The therapist does the exercises for low back pain, but you didn't have low back pain. Low back pain was your symptom. What did you actually have going on? Well, we don't know, right? We don't know whether it was a muscle, tendon, ligament, disc, or joint, or multiple of them, and we don't know which specific one it was, and we don't know which grade it was. This means that the type of treatment can't be specified to your issue, and we also can't come up with outcome measures to make sure you're proceeding the right way. They're specifically just going by pain. And that's not good because we just said your body's going to compensate, right? So your body's going to be compensating and moving differently to take you out of those painful movements and positions. But if we're not tracking actual biomechanics and the actual injury itself, we're never going to know if you're going to heal the right way or you're going to heal the wrong way, and we're going to have issues that come back in a little bit. So that is really, really important. On this board back here, this is what I go over with patients, is that as your body's healing, there's 3 phases of that process, and during each phase, specific things happen. And if they happen wrong, then we end up with permanency or more issues. And if they happen right, you heal the right way. And this is just biology of how the body works. And because we know this, not only do we look for a better diagnosis and more specific than just saying low back pain or neck pain or elbow pain, but we also use a combination of therapies like chiropractic and PT and physiotherapy and massage, depending on what's going on, to make sure we get the proper outcome measures so you get the best results. But not only do you get the best results, but they're lasting results because we understand how the body heals and we make sure it doesn't heal the wrong way. So if you have any questions, definitely you can give us a call. Also, what I'm doing for anyone, if you have any questions on this, is we can do a free 15-minute phone consult. This way we can talk specifically about what you have going on or what your question might be and see if it's something that we can help you with in our clinic. So if you're interested in that, go ahead and click below.